My name's Carolyn Warner-Greer. I'm board certified in obstetrics and gynecology and addiction medicine, and today I want to talk about prescription medications in pregnancy. When you first become pregnant and you meet with your OBGYN, part of your history will be talking about medications. It's very important that you tell your OBGYN all the medications you're prescribed, even the ones that you think have nothing to do with your pregnancy. It's also very important that you tell your OBGYN all the medications you were taking before pregnancy, even the ones that you think you're just going to stop because you're pregnant. Some medications are important to continue taking when you become pregnant and not abruptly stop them, as discontinuing them right all at once can be dangerous. Your OBGYN and you will discuss the medications you're taking and see which ones should be continued, which ones may need to be switched, and which ones may need to be tapered. Two medicines in particular that can be problematic in pregnancy are prescription opioids and benzodiazepines. Benzodiazepines are rarely indicated anymore to treat long-term anxiety. However, they're frequently prescribed by family physicians. During pregnancy, they can be associated with birth defects in the first trimester, as well as neonatal suppression, otherwise known as floppy baby syndrome. It's important, though, that you don't stop taking benzodiazepines abruptly, but instead that they're tapered off under the supervision of a skilled physician such as a psychiatrist. Your obstetrician may want to refer you to a specialist such as an addiction medicine physician or a psychiatrist to help with this, as well as find an appropriate medication to take care of your anxiety. Examples of benzodiazepines are Ativan, Xanax, Klonopin, Valium. Prescription opioids often also are still prescribed for chronic pain. And we also know now that most chronic pain is not well controlled with prescription opioids, and instead that they tend to produce tolerance and withdrawal symptoms. We know in pregnancy that continuing to use prescription opioids will produce neonatal abstinence syndrome, and if someone does not have addiction to these opioids, that they can probably safely be weaned off. Again, stopping these medications abruptly is not recommended, and your use of them and the indications needs to be discussed with your doctor so you can appropriately manage their use going forward with your pregnancy. Again, it's really important at the beginning of your pregnancy to be open and honest with your OBGYN of all the medicines you're taking, not only how they're prescribed, but actually how you take them in real time. So the two of you as a team can pull in anyone else to talk about how it's going to be managed going forward. Pregnancy is a great time to start becoming healthy, not only for your baby, but for yourself. If you have any more questions on how to manage taking prescription medications, please reach out to your OBGYN.